I'm Marsha Raebel, and I work at the Institute for Health Research in Kaiser, Colorado. And the work that I do is primarily related to medication safety. We were interested in looking at a population of patients who were undergoing bariatric surgery and looking at their opioid use before and after surgery. We had anticipated that patients' pain would improve after surgery. If they had chronic pain from, for example, back or hip or knees, we thought that with the dramatic weight loss associated with their bariatric procedure, that their pain would get better. And we really expected to find that opioid use would drop after surgery. And when we started to see the results and realized that that was not the case, but in fact opioid use went up after surgery, we were all very surprised. It's worrisome that opioid use escalated or went up in these patients for a number of reasons. We typically think of opioids as having side effects like constipation, but in fact in the United States over the last decade, unintentional overdoses have really gone up with opioids, and fatalities have risen with opioids as well. There are a number of lesser concerns with chronic opioid use, but of course the biggest one is the risk of potential inadvertent overdose. We are going to continue to study this. We are right now looking at the same cohort of patients, but looking at the people who weren't chronic opioid users before they had their surgery to see what happens with them after surgery. We can't forget that these analgesics are very potent painkillers and can be very useful to certain patients. We just have to make sure that we have a specific management plan in place between the prescriber and the patient to optimize the use of these drugs in a safe manner.